I'm Dr. Esther Dindi, consultant physician at Avenue Parklands Hospital. I've been a medical doctor for almost 20 years now, a consultant since 2013, and it's really been a pleasure serving my patients. You know, when I say I'm a specialist in internal medicine, many people wonder what that means. You just think of it like a pediatrician, what they are to kids, that is what I am to adults. My work involves treating infectious diseases, treating patients, this is adults who might have organ issues and, particularly hypertension, diabetes, liver disease, heart disease, and everything in between. It is said that wellness or being healthy is not just the absence of disease, but it's being well mentally, physically, and emotionally. That's really being healthy all around. And sometimes you might be walking around wondering, am I truly well? You don't necessarily have a disease, but until you're checked, you will not know your numbers. And so we have wellness checkups whereby, you get to know your blood pressure, you get to know your blood sugar, you get to know how well your liver is working, your kidneys, and many other things, because we look at your lipid profile and so much more. So there's the basic wellness program where you're taken through various investigations and examinations and measurements. And if anything is off, you'll end up in the physician's clinic whereby we get to see you. There are a number of us who work here at Avenue Parklands, and we are always happy to serve. Very good colleagues that I have here. But I would like to emphasize that it's important to know where you're at. Many times I get patients, they say, how is it that my blood pressure is high? I've never been diagnosed of this. And sometimes they're already having complications, which is rather unfortunate, but it's because people forget to just get those checkups. So as much as you can, get to know your numbers. You can just walk into the hospital, book to be seen at the clinic, and we'll run you through all this, because what you don't know can still harm you. What you don't know, you cannot address. I know many people in social media know me as Dr. Fitness because I am very passionate about lifestyle and wellness. And by this, I mean I'm very passionate about exercise, about healthy eating. And this is because they're very important. Let me tell you, there's a lot you can do to ensure that you're in good health by simply moving more, exercising, and being conscious of what you put in your mouth. So that is important. Before I send you to the nutritionist, I'll always, give you a bit of counsel from my personal experience, from my passion in fitness. But I want to tell you that you are in good hands when you see us. So we have a wellness program. And if you're unwell, I say that we'll take care of diabetes, we'll take care of hypertension, whether you have kidney disease, whether you have malaria, any sort of infection, all that. But if you're not feeling well, we are there to support you to remain well or get back to being well. When you meet people, many of my patients will tell me, I come from a family with diabetes or hypertension. But I like to remind the masses and my patients as well that genes load the gun, but your lifestyle pulls the trigger. So it's just important to know that your lifestyle can help you prevent disease or control it. So whatever you do on day-to-day basis has an impact on your health. Here at the hospital, we love to see our patients and know their metabolic profile, among other things. And by metabolic profile, I'm talking about, do you know your blood pressure? Do you know your HbA1c? That is your average blood sugar over time. Do you know your lipid profile? That is the cholesterol, and many other things, including your thyroid profile. So there are many things that we get to assess when we see you at the clinic or even in the wards. But one thing I am very passionate about, and my patients know this, I will always look at the bedside, because the bedside tells you a lot. Not just what is the medication that you're getting, not just what your visitors brought you, but what is it that you're eating. People get surprised. I am not a nutritionist, but I know that our health is highly dependent on what we put in our mouth. So when I see my patients, It's more than just being a medical doctor to them. It's more than just prescribing medication to them. It's important for them to realize that their lifestyle, which is easily forgotten, what they eat is very important. So before I get you the nutritionist, I love talk to you about what you should be eating or what you should be cutting on. And I will be encouraging you to move some more. I'm just keen on emphasizing that lifestyle does a lot in determining whether you will manifest certain diseases or not. So take charge of your health. You can do it.